welcome to the Hit Like a Girl podcast. My name is Joy Rios, and I am the show's host. On this show, we talk about how complicated healthcare is, not just in the US, but all around the world. We all kind of hold a piece of the big, huge 30,000 piece puzzle. And I like to talk to guests about the puzzle piece that they hold on to. So I'd like to give today's guest an opportunity to introduce herself. Go for it.
Thank you so much, Joy. So my name is Roopan Gill. It's a pleasure to be here. Thank you so much for the invitation. I'm co-founder and executive director of Vitala Global, a Canadian not-for-profit organization where we are co-creating digital platforms with women and girls living in challenging contexts around the most stigmatized issues around sexual and reproductive health with the focus on abortion. I'm also an obstetrician gynecologist based out of Toronto at the University of Toronto, and have a subspecialty training in advanced abortion care and complex family planning. So thank you.
So, yeah, my pleasure. And I like all of that is important to talk about. So which would you like to chat? I think I want to tackle complex living conditions. Like, how do you address that? And in what context are we talking about around the world, in the US, both?
Yeah, great question. Yes, both and.
Yeah.
So when we started Vitala, one of our products, it's called Contigo. So it's a digital abortion companion that we launched in Venezuela about a year ago. So when Vitala was started, myself and my co-founder, we both have worked with, Doctors Without Borders. We've worked in very challenging contexts ourselves as emergency obstetrician gynecologist. So we had seen, firsthand folks dying from unsafe abortions. We saw people dying in other maternal complications that are completely preventable. And so part of this intention of starting Vitala was to address that, but also to say that you can have these quality digital platforms or quality solutions be developed, embedded within community in some of these contexts, addressing some of these most stigmatized issues. And we wanted to prove that. So we started this work. We have this project in Venezuela. We co-created Contigo with over 1,000 Venezuelan women, over a dozen grassroots organizations. We launched it a year ago. We just celebrated our 1-year anniversary. And by building this trust and really sort of understanding the context, which for the listeners that are listening in, Venezuela is a legally restrictive setting in terms of the abortion laws there. It is a country that has been facing a complex humanitarian crisis. There's a lot of hope there. There's a lot of amazing people doing amazing work. And there's a really significant feminist network as well. So we were able to work under the guise of like a harm reduction tool or model. And now that we've done this, we've proven it, we've engaged over 3,000 users, we are now looking at, since the fall of Roe v. Wade in the United States, bringing our app and our solution to Latinas, Latinx folks, BIPOC communities there. And then we're also looking at other countries within Latin America.
Okay, I have a kinship with Venezuela. My ex-husband was, and his family were from Venezuela. I was actually able to visit in 2012 to kind of explore, which was a scary time. So like having an understanding of like actually being in that country and the safety issues that are there. I'm curious about the legal aspect. Like if there's legal restrictions there, is it illegal to have the app for harm reduction's sake? Like what are the politics around that?
Yeah, I know it's like, that's a common question we get, just because it is a legally restrictive setting, and it can be quite challenging. So in Venezuela, women can access an abortion, but only to save their life. However, what works in our favor is that information is not illegal in Venezuela. In other places, around the world, there are restrictions. Like Guatemala has a law that's saying that they even restrict what you can say about abortion. We know in Texas now there's all of this aiding and abetting stuff. So depending on the context, right? So in Venezuela, we are able to provide the information, and that's not illegal. And that's what we're doing. So Contigo is a digital companion providing the support and also providing, the psycho-emotional and social support as well for our users. So in that way it can work. And then the other piece of it is that we have really been very like deliberate and thoughtful about like our safeguarding and our cybersecurity policies that we have in place as well. So that is done in partnership with other organizations like legal counsel, etc.
I'm curious about how people find you, like, especially if there is, I mean, is it something that they could just Google and would they have to know exactly what they're looking for in order to find you? Or would it just show up? I don't know if that question makes too much sense, but I just imagine that in places where information is not easily accessible, like how do they get to you?
No, that's a really great question. So there's a few things like what we have done, like with when we started the whole process of like building Aya Contigo, it was done in building trust first with like the folks that are on the ground. So whether it's feminist collectives or a big sexual and reproductive health provider. And through that, in terms of building trust, understanding the networks, they are one of our ways of bringing in referrals to Aya. So for example, the big sexual and reproductive health provider, they don't provide abortion care, but they provide the counseling, they'll provide the information, and then they refer like users to us, and then we can support them. So it's through our partners. The other way they find out is through word of mouth, just from one another. And then we've also been doing a lot of work in terms of like our marketing and SEO as well, in terms of blogs. And so we have blog writers that are writing around this topic, and then just ensuring that, and then have a very good social media presence as well. So through the social media marketing and management of that. So these are the kinds of ways that we're bringing traffic to Aya Contigo.
Okay, the other questions that I have are, what is the user experience like, and at what point are they accessing you way before they're actually experiencing? And I, I mean, there must be a lot. Like, I guess as a user who is using that app, how did they engage? How long is the engagement? Is it a one-day thing? Is it prolonged over time? Is it leading up to an event? Is it after the event?
Yeah, no, great.
They-
Yeah, I can actually like maybe share more like what Aya Contigo, maybe it'll give more context if I share like what Aya Contigo does.
Yeah.
So Aya is basically like your your friend, your amiga, your coach that's like in your pocket, and is taking you step by step in terms of self-managing your own abortion. So whether that's from self-assessing that you're eligible to do the abortion, all the way to self-assessing that you've successfully completed it. And so it's taking you like step by step through that entire process. So when a user enters the app, it's basically like talking to you like it's your friend. And every like even the illustrations, even the way that we have like written the content, it's like that. So really feels very friendly. The other piece is that we have a virtual chat that's embedded within the app, because the app on its own, in terms of providing information, we realize is not like the app is not the panacea. You need human connection. And so we have this virtual chat piece where our users are connecting with 4 counselors real time within the app. So that piece about having those counselors is really to provide sort of that psycho-emotional and social support, because there's a lot that folks are facing in terms of stigma, in terms of connecting with and managing this complex ecosystem. So that's how they're like engaging with it. And then the other piece is we have a whole thing around personalized contraception tool, so they can answer a few questions, and then that gives them information on their contraceptive method that would be best for them. And everything is like, I like to highlight this often because I've worked for the WHO as well. And what we really feel and believe is that that women themselves can self-manage their own abortions as long as they're given the right information, and that they can be connected to a provider if and when they need it. But also that not only is it about averting like unsafe abortions or like the deaths or morbidity around that, but it's also about reproductive autonomy. So what type of experience are we providing them? Is it the type of experience that is, of quality, that they feel supported? And so that way it helps them and empowers them in the long run.
Now, okay, so now let's transition to the United States because it's complicated territory. How are you guys navigating all of the changes, especially as it differs state by state?
Yeah. So it's been really, I've actually been finding it super, um, well, optimistic in the sense that there's so many amazing people that are working and like fighting the good fight in the United States that we have been connected to. And particularly since we have this value add that our app is in Spanish, that we created it with Venezuelans, that it's like, for Latinas by Latinas, it is like an opportunity, because in the US, there's very few resources that have been Spanish created first, right?
Mhm.
There's a lot that are in English and then get translated. And so I think what's been nice is we've been chatting with all these partners, and folks are seeing a role for our work within this ecosystem. And through these partnerships is how we're keeping up to date, like with everything that's happening, because these folks and this is how we did our work in Venezuela too, right? Like we are mindful and thoughtful of the fact that, I'm not Venezuelan. So it's really important to connect with these partners and allow them to see how the app could work and then open the doors for us. And we're seeing that happening with various different partners on the ground in different states. We have conversations with even folks and providers within Texas, right? Just being very thoughtful of what that could look like, and would it even make sense? Would it be safe? Like we're very thoughtful and mindful of this before we're going to launch Aya in the US. We're going to do the
So
research.
it's technically not launched yet in the US. Okay.
No, our goal is the end of 2023. So we want to
Okay.
offer it in Spanish and English. We're wanting to do some user research and testing with Latinas, Latinx, and BIPOC communities. We're wanting to engage like the Gen Z population as well, and really get those folks on board that are interested in like advocacy and activism to be, champions of our work. So there's a lot we're doing right now that's helping us to move the needle forward to get Aya available in the United States.
Well, the other question I have, you touched on it a second ago. What are you looking at that is hopeful? Because I feel like a lot of people are starting to feel a little bit hopeless around like losing rights on a daily basis. Like, what
Yeah.
is it that we can look to as a guiding light for hope? Because I think that's a really important perspective to keep.
Yeah, no, definitely. Every day we're hearing a new thing. Just even today, I know with mifepristone being under attack in the United States. We've also faced these challenges every day with things happening in Latin America, or even, globally, like women's rights are under attack. But at the same vein, there have been so many things that have been, progressing, like in Colombia, where the law changed, and it's one of the most liberal laws now in the region for women's right to abortion. So what I would say, and I've been saying this often, the thing that's keeping me hopeful is it's the connections and like the collaborations, even just having this conversation with you, right? Like we connected through an event at HitLab, which
Mhm.
I feel like that even that community. So it's a lot. What's keeping me hopeful is connection and community, that there are people doing this work, that we are mission aligned, that we are really thinking about that person that's, requiring care. And we all want to see a better world in terms of women's health in general. So I feel that keeps me going, keeps me the fire. So that's what I would say.
Thank you. Okay, so this is kind of pointed, but I feel like it's important to ask, especially for people who oppose abortion and that they're how do you were speaking about harm reduction. Like what is your go-to point for people who are on the opposite side of the aisle and not proponents of the importance of this work?
Yeah, so the aunties, I guess, like how to manage that. It's very interesting because I was just from a personal standpoint, I'm South Asian, I'm Punjabi, like there's so much stigma in my own community. It wasn't until like the last couple of years where my own family was aware that I am an abortion provider and that I provide care for folks. It took them some time to even, like, they were okay with certain cases where I was providing care, but then they weren't comfortable when it would be like something that's just for from a choice standpoint. If it was a medical reason, it was okay. And how do I, sort of deal with this? I think, and the other side of it is that I've worked for Doctors Without Borders, where they did a lot of work in the last like 5 years, just over 5 years, in terms of really getting abortion talked about and in the humanitarian agenda as well. And there was a lot of resistance. And so what do you do about that? I think the way that I address it is try not to go in like full force aggressive, right? Like I think we need to be able to sit at the table and be able to table these different perspectives and understand where people's values are at. Like everyone has a limit in terms of where they are willing to go. Even someone who could be all about this work, right? There's still limits. So we need to be able to have some compassion and empathy and sit at the table together to understand where those values and attitudes are coming from. However, I will say on the flip side, there is also the folks that will just not change. I think we see
Yeah.
that in the politicians in the US. And the key is just to provide the evidence. I think that's one other piece, because I am a researcher and I really value some of my colleagues that are in the United States, like Dr. Ghazaleh Moayedi, who's from Texas. Like she is working hard, and what she's doing is providing the evidence, right? Abortion is healthcare. It is evidence-based. We have all the information and data to support it to be safe and effective, and the many reasons that folks need it. So I think like if we can center the arguments around that is how we need to approach it. But we do our best, because sometimes you just cannot change folks, but you hope for the best, because we have seen it that people do change when we see laws being changed and decriminalization happening in other countries.
I mean, I think Texas is a really good example. They've got that one lawsuit coming from the 4 women, right, who
Exactly.
have been affected. Can we talk about the lawsuit that's happening in Texas? So there's the 4 women that are coming up, and they basically have been affected negatively from their new laws. And it's not that any of them actually didn't want their children or the babies. It's just that it's medically necessary. And then the doctor has to choose between saving the life of the baby or the mom. Maybe you know more.
So, on this topic, it's really kind of highlights the need for this evidence-based piece, and how politicians are just coming up with these like sort of blanket laws without really understanding the gravity of what that could mean. So I think these folks that are coming forward with this lawsuit are highlighting that, right? Like the fact that if somebody has an abnormal pregnancy, I myself as a provider, I take care of all sorts of folks, people who have like, multiple anomalies, or like the fetus is not going to survive outside of the womb, is actually torture to that person who is carrying that pregnancy, because you are forcing them to carry a pregnancy that then labor, have that baby, and then it's going to not survive. So I think it's really important that these kinds of cases, because these are stories, and sometimes stories can be very powerful. And so to have this lawsuit come forward in this way, I hope somehow it will move the needle.
I agree. I mean, it's hard. It's really coming from a place of advocating for having more women at the table where decisions are made. This is a prime example of why that's important. If the people who are making the decisions don't understand the consequences, and they don't themselves actually have to face them, they're less inclined to care, right?
Exactly. Yeah. Yeah.
Yeah. So I applaud the work that you're doing. Tell me what you want to share, like without me prompting you. What is it that you want people to
Yeah.
know about? Yeah.
Well, I guess, like the work we do, I mean, I feel very proud, like, running Vitala. I always because one thing I've been noticing is like folks are like reaching out to us a lot, wanting to work with us. And I think it's the organizational culture that we've also created. And what I want to share is that this work is really hard, right? Like all of us that are in this doing advocacy activism as providers, even in folks that are doing the fundraising, the folks that are giving the money, there is a huge burnout. And you asked me the question around hope. And I will say, like, the flip side of it is finding ways that we also are taking care of ourselves and one another. So that's something that I wanted to share because to be able to continue this fight and to continue doing this work, I really value that need for taking the space and time to take care of myself. And that also means taking care of my staff, taking care of the people that are doing the work as well, right? And so yeah, I just wanted to share that because that's part of like another hat I wear as somebody who does, Kundalini yoga and breath work and meditation. And I'm trying to bring it into spaces so it's not separate to our work, but it is part of our work to deal with the work that's in our inner worlds so that we can be better activists in the outer world. So I just wanted
Well,
to kind of share
I
that.
think that makes a lot of sense because what you're doing is almost in and of itself traumatic. Like you probably
Yeah,
cannot continue doing it without at some point setting it down to take the time to take care of yourself. And I also really like the idea of community care. Like
exactly.
that's not, you also, the trust is involved in that because if you're going to be able to take a break and like replenish your resources. Like you basically need to trust that the folks in your community can carry the baton while you're doing that and that it will still move forward. But like, what does you mentioned a little bit about your self care, but let's talk about community care. What does that look like for you and your
Yeah.
community?
So something that we do, like, and I implemented this just like over a year ago with my team, for example, every first Wednesday of the month, we run through like sort of a session together, a self-care session, and it's not mandatory. Folks come in and a lot of the Venezuelan team comes, and this basically is me running them through like a practice. It could be a meditation, it could be some breath work, it could be a yoga set. So one thing that we do in terms of the self-care side is that I implemented something about a year ago because I really felt, just from my own personal experience, being a doctor, going through med school, working for Doctors Without Borders, working for WHO, I felt like there wasn't enough spaces for folks to um yeah, like to be able to be taken care of, and so this is what I do with my team. So we have this session, I run them through stuff, whether it's a meditation, we do some yoga, we'll have a conversation, we talk, we kind of get a sense of where people are at, and that also sets the tone for the entire month. So we have been doing this regularly, and then sometimes my team will ask me if they would like another session, and then I'll do something for them. So this community care, like that kind of sets the tone. But then the way we run our organization is quite circular. It's not like a vertical or horizontal. Like we have a lot of folks have a lot of autonomy, right? And I think that in itself also builds a lot of trust amongst the community and that they feel cared for, they feel that they're in a safe space, they can trust us, and they can share. I think that's very important to share things that are on their mind, and that a lot of it comes down to us offering a lot of these practices as part of the workplace.
That's amazing. So can you tell me what would be the best way for people to support you? I mean, it might be to reach out and say, how can I support you? But is it follow you on social or connect with you on LinkedIn? Or is there something, can they donate to your cause?
Yes, I was like, please. We're fundraising, especially as we have these big plans to like enter the United States and Mexico in the coming year. So please, 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 yes, you can donate. We are able to provide tax receipts as well for both US donors and Canadian donors. So if you go to our website, www.vitalaglobal.org, we have a support us section there. So check out our website, follow us on Instagram at Vitala Global. We also have at Contigo app on Instagram. LinkedIn is a very good place to connect with me personally, and I can get in touch with you. And we're on Twitter, so we have all of those socials, and we have Vitala on LinkedIn as well.
And then people should be on the lookout for when it is available for download in the US. Is that true?
100%. Yeah. Stay on the
Okay.
lookout. We are definitely full force working on that with the aim to launch by the end of this year.
Question that I have has to do with the users of your app. If they are self-administering their abortions, in what format is that happening? Are they typically taking a pill that they've gotten from a doctor, or like what is the user end aspect?
Yes, that's a great question. Yeah, in terms of just self-managed abortion. So it's medical abortion. So users are, it's with pills, and how they're doing that is, and there's various ways because we have self-managed is like the umbrella term, but within that there's self-assessment that you can actually do the abortion on yourself to self-assessing that you've successfully completed the abortion, and then the self-administering the pills yourself. And also, I think it's important to highlight that there's mifepristone and misoprostol as like the two pills that are seen as the abortion pills. But then you can also um, complete an abortion with misoprostol alone. And so
Okay.
that's kind of the crux of it.
So, well, if it's available in Venezuela, are those drugs available to women in Venezuela? So it's the onus is on them to go to a doctor, get those pills, come home, then they have a friend to accompany them through the process. Is that accurate?
No, so it's because it's so restrictive there, and also because of the context, like even just other medical supplies are just not available, and if they are available, they're very expensive. So mifepristone is not registered in Venezuela, so it's not easy to get mifepristone, and doctors are not prescribing it because abortion's illegal.
Right.
However, there is, in contexts like Venezuela, there is a clandestine market where folks are selling it kind of under the table, and then they again sell, and predominantly it's misoprostol, and they sell it for very expensive for a pill that is actually quite cheap. So that is how it's being, how folks are accessing it. And they're also accessing it by other international services. There's Women on Web, there's Safe to Choose, like these other organizations. Though they also have challenges getting the pills into Venezuela. Yeah, so that's kind of how it works.
So I think I only know this from headlines on the news, have not done any deep dives, but a lot of the pills, especially in states that it's restricted, are coming from India. I think that there is an organization that is just 100% dedicated to mailing these abortion pills. Do you know much
Yeah.
about that?
Yes, so it's Aid Access. So Rebecca
Okay.
Gompertz and her team. So I know her well, and yeah, so Aid Access is the main one. They're based outside of the United States, and so they are promoting and stating that they are selling or sending the pills to all 50 states. So that is
Okay.
their thing.
But did they also send it all over the world? Like, can folks in Venezuela get it from them too?
Not from Aid. So Aid Access is like the US side of the work that was started by Rebecca through Women on Web. So Rebecca
Okay.
started, like, she is like been a pioneer of this work with Women on Web and Women on Waves. So she's this Dutch woman that initially had like a boat, and she was providing abortions through the boat. And there's a documentary about it. And then there's Women on Web. So folks can. The challenge has become cost and also getting it across, like into their countries, because it just depends on the mailing and post and all that kind of stuff. So they do. Women on Web works globally and are selling pill and sending pills everywhere. Whereas Aid Access is very US focused.